Well, hey guys, so I'm here with Matthew, and he and his wife Rachel own the Back and Body Clinic. And Matthew, thanks for being with me.
Hey, my pleasure.
Hey, so before we kind of jump into the crazy times and everything that's going on right now, would you just share a little bit about you and Rachel, and then how the Back and Body Clinic got started?
Yeah, absolutely. So I'm a chiropractor, but we're not a chiropractic clinic. We're actually a primary medical clinic, primary care for family physical medicine, but we offer chiropractic and rehab as well. Rachel and I have been married about coming up on 15 years, actually,
Wow,
this next.
congrats. That's
Yeah,
awesome.
yeah. We have three kids. We live in Flower Mound. Our business is in Louisville, and we've been in Louisville for 10 years with this business.
Great.
But the business has actually been here a lot longer than that. I bought it from a previous doctor, a chiropractor who was in business for about 28 years, and I bought it from him 10 years ago. And I was in practice myself for about 5, 6 years, and really saw a need in the community for some way to bridge the gap in healthcare between all these different disciplines and specialties. And I saw patients that really wanted the access to medical care and what it can provide, but also wanted a more conservative, natural approach first before diving into things with, that's more invasive and different side effects. So I partnered with a medical doctor a few years ago, and we became a primary care facility. And so we now obviously see musculoskeletal issues, your back pain, neck pain, headache, shoulder pain, knee pain, and those sorts of things. But we've also specialized and grown over the last few years in providing your annual physicals, your sick visits, lab draws, and providing different kinds of joint or trigger point injections for muscle trigger points or for joint degeneration. And we also have grown in the last year in regenerative medicine, so PRP, stem cell, and we're really growing that and providing a need for those patients that are trying to stay away from joint replacements. And in fact, 2 months ago, we actually partnered with UT Southwestern, and so we're now an affiliate practice of theirs. And so we're now in the same networks, health insurance networks, and the same EHR as our electronic health records. We share those now with the hospital system of UT Southwestern and all the other practices. So that's been an exciting thing the last few months.
Wow, well, that's fantastic. And before we started recording, you'd shared a little bit about like some exciting things that have been happening, and it sounds like you guys have been kind of on the cutting edge and like pushing boundaries. You also mentioned to me that you guys just moved into a new facility, which is almost double what you were in before. I'm sure that brings some additional overhead and expense. So how has this kind of crisis been impacting you and your business?
Well, absolutely. It's definitely affected us in many ways. And the last 2 weeks have just been a blur for us, but I know it's been a blur for so many businesses in the community. And as of now, we are still open. We're still considered essential
Yeah.
as a healthcare facility, according to the Denton County ruling that came out yesterday. And so we're still open, but we've had to radically change how we do our business quite in a lot of ways. But thankfully, we are still in business, and I know there's a lot of other businesses out there that can open their doors. And so, for those, I really, I feel for them and want to support them as well. But how it's affected us in healthcare, this is something that, well, as a society, we haven't seen in decades, not 100 years, really, in America, pandemic like this, and the response is, as hard as it is to swallow, really is appropriate, unfortunately, but it is the appropriate response in order to save lives and in order to keep our way of life for the near future and be able to come out of this with the least amount of harm and damage. So as a healthcare institution, as soon as the virus hit the U.S., we started taking precautions in our clinic that have just continually ramped up as the threat has come closer and closer to home. So we now, every employee that comes in, first thing, they're getting their temperature screened. We're getting a health history on them. If they've been in, how they've been feeling. Are they exhibiting the three main symptoms, fever, coughing, shortness of breath that are related to coronavirus? And or have they been exposed, or anyone in their home been exposed to or showing symptoms like that? And if they have, then they're staying home, and there's
Yeah.
just no question about that, and quarantining themselves. We're also deep cleaning, sanitizing our office, which we have a brand new office, thankfully, which was very clean to begin with. But
No old messes. Yeah.
yeah, so and to your point, what you said a second ago, on March 2nd, we moved into this new facility. We moved from 2,500 square feet to 4,300 square feet with more exam rooms and adjustment rooms and rehab bays. And so it's given us a lot more space and allowed us to adapt in some new ways that I'll share in a second. But we deep clean, sanitize our office every day, multiple times a day. In between every patient visit, everything a patient comes in contact with, we are deep cleaning, sanitizing. And then we're wearing more PPEs or personal protective equipment during our patient visits. So we're adjusting and seeing patients with gloves and certain gowns if we need to when we're seeing patients. We're also keeping that 6-foot distance, that social distancing as much as possible, unless we're doing a procedure or an exam. And even at that point, we're practicing clean, safe techniques as much as possible. So that's something we've been doing even before the ruling a few days ago in order to still take care of our patients and provide care in a safe way. And we're also identifying patients that are elderly or high risk, or they're immune deficient, and we're identifying those and explaining to them the risks and making our own decision or letting them make the decision to continue care by coming in the facility. So what the newest thing though, at the beginning of this week, well, to back up, maybe some people listening already have heard this and know, but last week, Governor Greg Abbott issued a emergency declaration order to the Texas Department of Insurance to radically change how they do telemedicine. And telemedicine is something that has been around and Medicare did the same, and Medicaid through Texas, and then the CMS, Center for Medicare Services, they issued a proclamation as well last week to expand telemedicine. And what this does is, telemedicine has been around for a long time. The technology is already there. Obviously, we're almost having what you could call a telemedicine type of visit, like a Zoom call right now. There's some certain rules for HIPAA that the technology has to follow, and some certain informed consent and things that need to be done. But even those, with the ruling last week, have been relaxed for a temporary amount of time. So right now, you could really do telemedicine visits on FaceTime or Skype, and that's completely allowed right now, but not recommended, and that's not what we're doing. So we had never done telemedicine before this week, and now we've already seen, we saw a couple patients the other day, we saw 3 or 4 yesterday, and today we have 6. So we're definitely expanding in that telemedicine world. And so it's been around a long time, but it's only in the past been available for rural areas. So, deep West Texas, where there's not a specialist for hundreds of miles. And a lot of times it had to be done where the patient had to go into a local clinic and see a specialist in Dallas, for example, through that clinic. They couldn't do it at home. Well, now they've expanded where you can do at-home visits, and Medicare, Medicaid, and commercial insurances will now pay for those visits just like they were in-office visits for the foreseeable future for this declaration of emergency. And what's interesting is that telemedicine there's been a big push for a long time to get this going. With this emergency order, they really opened up and let the cat out of the bag, and to an extreme degree. And even after this emergency, my take on it is I don't foresee they'll completely put the cat in the bag. So I think this is a new frontier that we're radically on in a short amount of time. And so this week we've really expanded in that, letting our patients know that we offer that. And even for, believe it or not, even for chiropractic visits, medical visits, for all these visits, because obviously I can't do an adjustment. We can't provide an injection over the computer, but we can at least check on our patients, and we can consult, and we can answer questions, and we can be there for them and be a resource for them during this time when there's a lot of misinformation on Facebook and social media and different places. We can give them accurate information in the comfort of their own home, and then, be able to prescribe any needed medications or order any braces or supports during this time, or send them any stretches or exercises or things to keep doing at home until we can meet again after this crisis.
Man, that's awesome. So uh, I'm hearing this. Let's say that I'm somebody that's like, man, I wonder if this would be a good fit for me. So what things would you see this being like a good fit for during this time, and how can they get in touch with you?
Well, yeah, fantastic. To get in touch with us, our website is backbodyclinic.com.
Okay.
Definitely go there. You can contact us through our website directly. And then there's also, and we also have a notice on there about telemedicine and during the COVID-19 outbreak and that we're still open and what we're doing there. And then you can look a little bit more at our practice and the services we normally offer are still open and offering with these clean, safe techniques. But then the services that we can offer are we can consult, we can examine many things. A lot of patients nowadays have diagnostic equipment at home, so you have your home blood pressure cuff, or you can
Sure.
take your pulse at home, or your temperature as well. And if you're wondering, oh, I have a 99 or 100-degree fever, I'm feeling a little congested, do I have the coronavirus? And unfortunately, in the world at this time, that is a legitimate possibility. We can see a new patient or an established patient, doesn't matter. We will send you, you contact us, we'll schedule an appointment, just like any other appointments, so say 2 p.m. or whatever time, and we'll email you paperwork, our new patient paperwork with informed consent for the telemedicine visit. You just email that. You can even take a picture of it if you don't have the ability to scan it. You just take a picture at home and email it back to us. And then we get that information. We'll send you a link to our virtual waiting room, and then patients can go to that virtual waiting room and they click into there, and then one of our staff meets them just like this in a room in our clinic and sees them on a webcam and can get their history, see any vitals they have at home, can get whatever they normally would to the best of our ability, and then and then step out, and then one of our providers gets that information, and then they can meet you in the room, answer questions, and if any tests need to be ordered at another facility, or we feel you're safe to come into our facility, we can screen for that. If we feel that you are at risk for the coronavirus, we can send you in the direction of our local testing centers, because we do know those, and we have the latest on those, but those are rapidly changing too. But we can send you in the right direction. And what this does is it also, we're right across the street from Medical City, Louisville, right off of I-35 here. And last week we contacted the hospital and just, what do you want us to do if we're suspecting a coronavirus patient? And they said, do not send them to the ER if you don't have to. Please, if there's a life-threatening emergency, send them to the ER. But if they're just having those initial symptoms and you're suspecting, please don't send them to the ER. So what we can do through this telemedicine visit, we can screen, and then we can send you in the direction of the local testing centers where they're more prepared to deal with this.
Wow, that's
And
awesome.
that way our ER emergency room doesn't get overrun, and they can see the true emergencies and be able to keep those hospital beds that are needed open for the most needed patients. And so we see, we can examine, we can consult, we can prescribe, and to your local pharmacy, and we can prescribe any needed medications. We can give advice, we can give consult, order tests, order imaging or anything at another facility. We can also give stretching at home exercises for low back pain, musculoskeletal issues, or we can order a brace or support or something to be shipped directly to your home as well. And so all of that can be done while you sit on the couch at home. And
Wow.
yeah, it's pretty amazing. In light of the crisis, it's a pretty exciting thing, but in light of the crisis, that puts a dark shadow on it. But we're happy to be able to offer this in this time.
Well, I'm grateful that we got to connect and that so many people are going to see this and know, because I think one of the things that's really challenging right now is like, where do I go for good information? And just the idea of, hey, I could meet with a doctor, not leaving my home, not exposing myself to risk, and get kind of that first like good information to know, okay, is this super serious, or can I like just get a prescription filed or something like that? So man, Matthew, thank you so much for meeting with me today. And I know everybody that's watching this is going to be blessed by it. And man, all the best to you and Rachel, your family, and your business in this tough time. I know you are hurting, but I just want to say I'm grateful for the fact that you're stepping in and trying to help people too during this time. So they can visit your website, backbodyclinic.com. And then what's your phone number as well?
So our phone number is 972
Okay.
436 9785.
Yep.
And our direct company email is info@backbodyclinic.com. And then we're very active on Facebook. I think it's at Backbody Clinic.
Yep.
My wife,
I'll tag you in the post.
thank
So,
you.
yeah.
My wife is definitely more on top of that,
She's
but
on it, man. Yeah, she's good. She's been
she's
on it.
awesome. Yeah.
Awesome, man. Well, man, once again, grateful for you. Thanks for meeting with me, and you take care.
Hey, thank you. And one more thing, if I
Yeah.
can, I just want to say God bless all those businesses. I know how hard it is with what we're going through. But all those businesses, all those people who may be actually sick or just hurting financially or just lonely, quite
Yep.
honestly,
Yep.
maybe who are living alone at home. Any way that we can serve you or help you, we're here for you. But God bless you. And we're praying for all of you. And we're going to come out of this one way or another in a good way. It's just a matter of time.
Amen, brother. I appreciate you, man.
Hey, thank you.